Good day, viewers and listeners, and welcome to today's edition of the COVID-19 update. I am Godfrey Brooms, and as usual, we will be soon meeting the Minister of Health, Dr. Frank Anthony, who will be speaking about the government's upgrades of the regional hospitals to cater to persons that need hospitalization or isolation that tested positive for COVID-19. He will also update the nation on the COVID-19 safety measures in the workplace post-vaccination.
Well, as it relates to COVID-19, we have done a number of modifications to our current regional hospitals. So in Region 1, we have a section of the Mabaruma Hospital that can accommodate COVID-19 patients. We also have at Port Kaituma a section of that hospital that is dedicated to COVID-19 patients. And that's where over the last several months we have been isolating COVID-19 patients, and if they require care, they can get care in Port Kaituma. We also have sections of the Kumaka Hospital in Region 1 where we can do that type of isolation as well. In Region 2, we had since last year, dedicated one of the buildings within the compound of the Sodi Hospital for COVID-19 patients, and we have been able to repurpose that to make sure that we have adequate ventilators and oxygen supplies so as to cater for COVID-19 patients. So that's a relatively big facility, I would say. We can accommodate up to about 20 patients in that facility. We have not gotten to the full capacity, and that's probably a good thing. In terms of Region 3, we had extended the COVID isolation for West Demerara because, as you can see, currently we have a number of cases in Region 3. And we want to ensure that we have the right capacity to take care of those patients. So at West Demerara, they have created space for up to about 50 patients, and they have put in all the requisite pipings and so for oxygen, and also they have several ventilators that can be used if these patients are critical. And also because of their proximity to Georgetown, if they already have severe persons with severe COVID, they can easily transfer them to the COVID-19 hospital. In Region 4, our capacity, while it's primarily at Ocean View, we have also retrofitted a lot of the health centers in Region 4 and added oxygen capacity to them as well. So if there are persons who come in to these health centers, they can get some form of care. In Region 5, at Maikoni, we have also been able to repurpose one of the buildings at Experiment, the Experiment Health Center, to cater solely for COVID-19 patients. And currently we are doing additional works to the Maikoni Hospital to have an ICU type of arrangement for severe COVID-19 patients. In Region 6, we have two sets of facility, one located up in Skeldon, where we can do isolation and treat some of our mild to moderate COVID patients, and we have a similar arrangement in New Amsterdam. But most of these patients on the coastline, if they require additional care for severe COVID, they're usually transferred to the Ocean View facility. Similarly with Region 10, while we do have capacity at the Linden Hospital, again, if it's severe cases of COVID, they're usually transferred. Bartica, we also have a capacity there within the Bartica Hospital. Madhya, we have built capacity. We also have in Region 9, we have ensured that the Lethem Hospital, would have capacity to deal with COVID-19 patients. Just recently, we have commissioned a 6-bed ICU in Lethem. And so if there's a need to at least stabilize severe COVID-19 patients, they're able to do that at the Lethem Hospital. Well, post-vaccination, the cases are going to be less because the vaccine have been demonstrated, or we have seen that when you're fully vaccinated, there's a less chance of transmitting the virus. While the vaccine also protects you from getting the severe form of COVID and reduce the possibility of death. So vaccines do have that ability of reducing transmission. Some of the studies that have come out have demonstrated that. So we don't expect in a workplace environment where everyone is fully vaccinated that you will have a lot of transmission. And even if transmission do occur, the persons there would get a very mild form of the disease. Well, it all depends on what safety measures have been put in place at that particular work site. If the work site is adhering to the COVID-19 measures, which mean that people would have to keep social distance, sanitize their hands, wear masks, then you will have a reduction in cases, almost zero cases, and of course if they're fully vaccinated. So if people observe these requirements, then the cases would be far less. In addition to that, if you're working in an indoor environment, it's preferable that the building be properly ventilated so that just in case if there's a COVID-19 patient or person come into the building, that the building is adequately ventilated and those viral particles do not remain in the building. Well, here in the ministry we have a mental health unit, and if there are persons who require counseling, they can go to that unit where our counselors would provide that sort of counseling. But generally, we have been offering a service at the level of the health centers, because over the last year, we would have trained a number of doctors in the primary health care setting to look out for mental health conditions, especially those associated with COVID. We know that persons who might have been exposed to COVID, and if they have to quarantine and things, there might be a lot of anxiety and worry. In some cases, persons who have been sick can get depressed, which can create more problems for their ongoing conditions. So they might require some type of help, and we have trained a number of staff to be able to offer that type of help. We have also seen that even after persons have recovered, that they can have mental health challenges, because one of the forms of long COVID can be with persons that experience brain fog, meaning they can get confused and so forth. In the midst of a conversation, they can forget things and that sort of symptoms. So there is that as well, and these persons might require assistance for at least another 6 months or so. So we are training our staff to respond to the emergence of these types of signs and symptoms, and hopefully it would help the persons or the patients who have these conditions.
And that's it for the COVID-19 update. For more information, you can visit the ministry's website, health.gov.gy, DPI's website, dpi.gov.gy. Godfrey Brooms saying goodbye for now.